Hello, my name is Amanda Mackay, Nurse Consultant for Learning Disabilities, and we have made this video to help people with learning disabilities who are coming to Calderdale and Huddersfield NHS Foundation Trust for an operation. Visiting a hospital can be scary for anyone, especially if you do not know where to go or what to expect. You might be visiting on your own or have a family member or other support with you. We want to support you the best way we can, and if you tell us about any reasonable adjustments you need, we will try to help. This may be finding a quiet area or ensuring that you are not waiting for a long time. For more information, you can go to the Trust website. We have several locations where you might visit for your appointment. We have two hospitals, Calderdale Royal Hospital and Huddersfield Royal Infirmary. We have theatres at both hospitals where operations take place. You might be a day case or you might need to stay overnight for a few days. We have car parking facilities. You can find out more information on the website. Before your operation, you will have been given instructions about what you can eat and drink on the day of surgery and at what times. For a morning admission time, you will eat the night before and not that morning. You can have your normal medication with water or clear juice only. Only stop medication if someone in pre-assessment tells you to. For an afternoon admission time, you will be able to have breakfast, and normally you can drink water or dilute juice on the day. Please avoid any chewing gum and do not have any milk, juice with bits in or fizzy pop. Be prepared, bring things to help you while you're waiting. Distractions such as cuddly toy, music or an iPad. Bring your hospital passport with you. Pack an overnight bag. Bring items that you will need during your stay such as your pyjamas, slippers and toiletries. On the day of the operation, you will go to the area that pre-assessment told you to go to. This might be the day procedure unit at Calderdale Royal Hospital, the elective surgery unit at Huddersfield Royal Infirmary, or directly to the ward. You will check in at the reception desk, tell them your name and date of birth and the first line of your address. The reception staff will let the nursing team know that you have arrived. They will take you to a quiet area and the nurse will check you in. They will ask you lots of questions, but if you want, your family or carer can answer them for you. They will ask you questions such as what time you last ate and drank, any previous surgery, if you have any metalwork in your body, if you have any loose teeth, any allergies, and any other questions about your general health. You will be asked to change into a theatre gown and maybe to wear some surgical stockings. However, we will talk to you about any reasonable adjustments you might need and if it's possible to keep on your own clothes. If you have periods, the nursing staff will ask you the last day you had one. You will be asked to do a urine sample. This is to test if you are pregnant. The theatre staff wear scrubs. They are below uniforms and they look like pyjamas. They also wear hats. The anaesthetist is the doctor who will give you a good sleep and make sure you are comfortable before, during and after surgery. You will meet them before the operation. Sometimes we offer medications before to relax you. The anaesthetist will talk to you and your family and carer about this. You will also meet the surgical doctor who will go through the operation and answer any questions you might have. Your family and carer can ask questions on your behalf. They will check the consent form if completed before or take consent on the day. The surgical doctor may mark the area of the operation with a pen. When it is your time to go for the operation, a member of the theatre team will come to collect you. They will go through the questions again with you. You can go to theatre by walking, wheelchair or on a trolley. When you are in the anaesthetic room, there is lots of equipment and different members of the theatre team. Your family or carer can come with you if you need their support. If you need distractions such as music or a projector on the ceiling with your favourite programme, this can be arranged. There are two ways you can be put to sleep. We can put a tube in the back of your hand and give you some magic milk, or we can give you some gas through a clear mask. Both are pleasant ways to go to sleep, and gas normally smells of something you really like. We might put a peg on your finger to watch your heart rate and 3 sticky dots on your chest to listen to your heart. We may need to take your blood pressure. We will place a cuff around your arm. When the machine is working, it will go tight. If you would find this upsetting, we can do this whilst you are asleep. If you are worried about any of this, you can talk to your anaesthetist and we will make sure we make reasonable adjustments to meet your needs. When the operation is finished, you will go into the recovery bay and will be looked after by the recovery team. They will monitor your heart rate, your blood pressure and temperature. They will make sure you are comfortable. Once the recovery team are happy, you are ready, they will take you back to the ward or department. Your family and care team will be there with you. You will have more checks done by the nursing team, including blood pressure, monitor your heart rate and take your temperature. You will be offered something to eat and drink, good old NHS toast, jelly or ice cream. If you have a special diet, please tell the nurses, or you can bring your own food or drink if you prefer. Once you are ready, you can get dressed into your own clothes. Once the nurses are happy that you are ready to go home, they will give you your discharge letter and any instructions. This will include whether you need to come back to the hospital for follow-up appointments or whether you have been discharged back to your GP. Your GP will also get a copy of the discharge letter. Thank you for watching this video. I hope you find it helpful. Remember, we are here to provide the support for you to get through your operation. If you need any advice or support, please get in touch. Thank you.